Octavius Williams, thank you so much for joining me today.
Thank you for having me today, Ms. Breakboy.
You know, this is the month of December. We just celebrated Thanksgiving. Folks are celebrating Hanukkah. We'll be celebrating Christmas and Kwanzaa and all of the other holidays that are celebrated by our various religions that make up Prince George's County this time of year. And so it's great to have a partner like MISO. I know I was with you this past weekend providing toys for very deserving little boys and girls and their families. So that was just wonderful. But you know what, during this season, we also find that people are dealing with a lot of stress. Some are dealing with depression and other issues that really impact families. And so can you talk a little bit about, you know, the work that MISO does to help address some of these issues and what we need to be paying attention to around the holiday season?
Yes, like you mentioned, MISO, we do fabulous outreach. No better time than to do it is definitely through the holidays, from the Thanksgiving through the New Year's time, but the mission just doesn't stop there. We have plans to engage with our team, our community throughout the entire year. We're looking at events that will broadcast for at least the next 2 to 3 years. When we're looking at our youth, we really have to do all we can to stay engaged with them. These community-based organizations and our outreach and our efforts to outreach the community helps bring everything together. During the holidays, it is a more unfortunate time. This is when folks feel more singled out, more left out, and we do see greater depression, more mental illness. It also has to do with the winter equinox, where you have more times and hours of night. We also know that that can lead to other justice issues when we do have folks that are out there manically depressed, going through things. And then you also have some that are so depressed that they're willing to do anything to get out of that depression, include rob and take from others in order to try to fulfill with some of those things that are lost for them throughout the holidays. But MISO and our mission is to be able to bring that back together, bring that back to the community, and not put a value on a gift, but put a value on the community and show that each neighbor can actually help someone through a crisis. One of the things that we really pride ourselves on is having not only our administrative staff, but our frontline staff trained in mental health care, mental first aid. Mental health first aid is cutting edge, and it's something that we would like to be able to go to the schools to teach teachers so that they can recognize when things are happening. Administrators, police, law enforcement, and also even this past weekend we had like the park police came through, and also we had the fire department. All those frontline workers need to really understand mental health as a first aid.
So can you talk about how mental health first aid training goes and what you learned during that training?
Yeah, so during that training, some of the first things you learn is someone's body language, and you get a good physical appearance of them. So you can understand if they're under the influence of a substance, if they recently abused a substance, are they dealing with any kind of toxicities? You're also looking for some of those telltale mental health elements that may be happening. Does this person's pupils dilated? Are they looking, can you visibly see some bipolarism going on? A lot of the times our law enforcement officials are there to contain the situation to make sure everybody safely walks away from it. But once we walk away, what happens with those folks that are dealing with it? The acute crisis of mental health can be exacerbated very quickly. So someone sitting in the back of a police car that was not, was mildly manic can become severely manic in a moment of time. So MISO and what we would like to do is collaborate with the community, be able to have those officers reach out to us, be able to hop on a Zoom session and bring telehealth to where we really know telehealth can go. We can be right there on the scene at a safe distance, do things very compliant, very well, and get it done and active right then and there. And we can start to prevent from some folks being arrested. We can start to do peer and mental health evaluations with families so we can get to the root cause of the issue, because we may find other underlying things that are truly criminal activity. Someone could have been abused and the child acted out in school. we can see where these puzzles come together from every angle. And it's a all hands on deck thing right now, especially with what I would call a community healthcare crisis that's been exacerbated through opioid use. And even with the opioid use with fentanyl, it's in some clients not even showing up on urine tests. The synthetics are where I see our future and our fight to end substance abuse is going through more synthetics. And in our analysis, when we looked at the kids, a lot of them don't understand that what they're listening to in popular culture music, lean and drinking codeine, is your first dive into heroin. They had no association with that. That is the start of the opioid. So as we get to these preventative measures in our community, and we're able to work with police officers on the front line, that when they start to see those things that are happening, using their mental health first aid training, and then they call in someone like MISO while they're sitting in the back of the cruiser, and they put a tablet in front of that person and say, hey, can you guys talk with this person? And let's see, once we get them detained and calmed down, we work with the commissioner and see what a proper community treatment plan needs to look like. Notice I said community treatment plan because we're no longer working with just healthcare. This is a community crisis that we have to approach.
Absolutely. You know what, Octavius, I'm so grateful that we have MISO Medical here in Prince George's County. I'm so grateful that you to work with us and that you've reached out to the law enforcement community and said, hey, we are your partners. And you're absolutely right. There's a lot of training that we can get. And then there's a lot of work that you can do along with our police and our sheriffs and other partners that are on the front lines to really address those individuals, you know, when that call is made. Because sometimes we know it's a call for someone with a mental health issue, but the call is to police. But the response should not only be law enforcement, it also should be healthcare enforcement or mental health care enforcement. And so we are really excited to have a partner that really understands that role. So we are super excited, again, that you have opened in Laurel, Maryland, but you do serve the entire county of Prince George, correct?
Yes, that is correct. And one of the things that we've been looking at is how do we break ground into new forms of therapy, new forms of helping not only the criminality part of it, but the victims. One of the big things that I've approached our owners and directors here about is we have to chase down sex trafficking victims and get them holistic healing. A lot of the times, once they're picked up from police department, they may be returning to who knows what kind of environment. We really want to give these folks a safe haven to go for 30, 60, 90 days, a year, whatever it takes. These folks have been tormented. Some of them forced into substance abuse, forced into all kinds of mental anguish, some physical abuse. It is a crisis that I can't Google and find any groups out here that are doing it. And when I came here and I talked with MISO, I really, really and passionately want to pursue that and be able to help sex trafficking victims. In Prince George's County, we have a wide diversity of folks from around the world. One of those things that around the world diversity has brought, and we have seen, is that we did go through an uptick of that in the previous few years. What happens with those victims is not always public knowledge, and we would like to keep it that way by still doing a public-private partnership where after someone's rescued publicly, we can take them into a private practice such as MISO, who's going to continue that public-private partnership and give you guys great outcomes, because a lot of times we don't feed back Justice Department to let them know what the outcomes are. And as the healthcare industry is going to pay for performance outcomes, we want to be the forefront of that and do that in a public-private partnership that really help these victims of sex trafficking.
You know, that's, I'm so happy you brought that up. We created under my administration, a human trafficking diversion program where we do work with providers who can assist those who have been rescued or need to be rescued and who, you know, come in to contact with our office. We are able to really direct them to our community-based partners. But we always need more providers because everyone accepts treatment differently, and everyone maybe they are more inclined to listen to one person over another. So we want to give them a variety of providers so that they are in the appropriate placement for their needs. And so it's great to have MISO as a partner now, and we'll make sure that we connect you with our human trafficking diversion program. So thank you again, Mr. Williams, for joining me today. I see that we're going to have a very long and fruitful partnership. And again, I am very thankful and grateful to have MISO Medical open here in Prince George's County, and we appreciate the work that you continue to do in our communities.
Thank you so much. We again appreciate your time this afternoon, Ms. Braveboy, and we look forward to continuing to save as many lives as we can here and continue to make Prince George's County one of the greatest places to live on the planet.
Thank you.
All right, thank you. Have a good day.